Approximately 3.3 million adults in the US suffer from obsessive-compulsive disorder, and chances are you might know one. But what is OCD and how prevalent is it in society? You're about to find out on this episode of Seco's Psych. Obsessive-compulsive disorder, commonly known as OCD, is a psychological disorder that interferes with daily life. The disease has two main aspects: obsessive thoughts and compulsive behaviors in response to those thoughts. Commonalities of OCD are excessive or repeated actions, such as washing hands until they're raw or checking to see if a door is locked multiple times. People with OCD experience a variety of symptoms in which their thoughts lead to almost uncontrollable actions that affect their daily lives.
Diagnosing OCD can be quite difficult, not only because we don't know exactly what causes OCD, but also because the symptoms that people display can often be similar to those of obsessive-compulsive personality disorder, anxiety disorders, depression, schizophrenia, or other mental health disorders. The diagnostic criteria comes from the DSM-5 published by the American Psychiatric Association. Signs or symptoms that you can find of people who have OCD range from both obsessions and compulsions. Now, the obsessions include repeated unwanted ideas, fear of contamination, aggressive impulses, persistent sexual thoughts, images of hurting someone you love, thoughts that you might cause others harm, and thoughts that you might be harmed. Some signs of the compulsions include constant checking, constant counting, the repeated cleaning of one or more items, repeatedly washing your hands, constantly checking the stove or door locks, and arranging items to face a certain way. There are also emotional symptoms that can arise, with people suffering from OCD being generally very anxious and emotional, and there can also be physical symptoms.
Obsessive-compulsive disorder is treatable, but as of today, not curable. Treatments for OCD help bring symptoms under control so that they don't rule your everyday life. And some people need treatment for the rest of their lives. There are two main treatments for OCD: psychotherapy and medications. Often treatment is most effective with a combination of both. CBT, or cognitive behavioral therapy, is the psychotherapy which is most effective for OCD patients. Antidepressants are the most commonly used medication for treating OCD. In general, the goal is to effectively control symptoms at the lowest possible dosage. It is not unusual to try several drugs before finding one that works well. It can take weeks to months after starting a medication to notice improvement in symptoms.
Organizations such as the International OCD Foundation are dedicated to finding new solutions for patients with OCD. Many universities such as Johns Hopkins, Yale, and UCLA also have departments dedicated solely to the study of OCD. Recently, a study was published in the Biological Psychiatry Journal that showed inhibiting a neurotransmitter receptor known as MGLUR-5 stopped obsessive-compulsive behavior in mice almost immediately, within a minute time frame. Researchers also found that the MGLUR-5 receptor is always on, causing compulsive behaviors nonstop. It is clear that research in the field of OCD has progressed greatly, and many scientists are making groundbreaking discoveries even today. In the past, OCD has been considered a form of religious melancholy, intellectual disorder, and even a form of partial insanity. Now, however, the future of OCD research looks positive, and there is no doubt that even more discoveries will be made in the future of OCD research.